challenges of accessing overseas treatment under the new healthcare scheme of SHA continue to weigh heavily on many families. One such case is that of 3-year-old Faustine Muriithi Wakini, whose family is struggling to raise 12.5 million shillings for her scheduled bone marrow transplant in India. Under the current SHA package, the overseas treatment benefits are capped at 500,000 shillings, which is just 4% of the total amount needed. Sheila Chalangant reports on the struggles that patients face as the government rolls out SHA.
Concerns have been rife on patients seeking services overseas, reason being SHA's contribution to overseas treatment is capped at 500,000 Kenyan shillings, this leaving thousands of patients in limbo.
The bill given is around 12.5 million, which even if SHA gives us the 500,000, we still have a major gap to cover the cost of treatment.
It is the situation that Mary Nduta finds herself in as she ponders the next step for her 3-year-old daughter, Faustine Muriithi Wakini, diagnosed with Fanconi anemia, a rare inherited condition that affects the bone marrow and other parts of the body.
For her case, she has low clotting factors, and that is why she always has nose bleedings, gum bleedings, and also small bruises. Takes time before her blood clots.
A beneficiary qualifies for overseas treatment if they are registered with the Social Health Authority, if the treatment is not locally available, and if the overseas health facility they are referred to is contracted by SHA.
The only treatment is through a bone marrow transplant, which is not available here locally.
Nduta says like the 19.2 million Kenyans registered for SHA, she hoped that this medical situation would not drain her financially.
How many more of Harambes do you have to do so that you can get that 12 million? And imagine, even as you are getting, as you are looking for that money, you are still spending some of that money to seek treatment, to get the management of the condition here locally.
Between 2021 to 2022, a total of 569 patients were sent abroad for specialized care, with India accounting for over 80% of these referrals. Singapore, South Africa and Israel are other countries where Kenyans sought specialized treatment.
Many patients are suffering because of the introduction of what they call SHA. This is something that needs to be resolved properly so that people can get proper medical attention.
The Ministry of Health had indicated its plans to expedite the review of SHA benefits package, which had initially been scheduled to be conducted after 2 years, following widespread complaints by those seeking services abroad. Nduta can only hope that this happens immediately to ease this burden and get treatment for her daughter. Sheila Chalangant for TV 47.